Question 1. Which task should the nurse assign to the LPN in a Med-Surg unit? A. Conducting the initial assessment of a post-op patient. B. Evaluating the effectiveness of pain medication. C. Reinforcing dietary education for a diabetic patient. D. Teaching wound care to a newly discharged patient. Answer. C. Reinforcing dietary education for a diabetic patient. Question 2. A nurse walks into a room and finds the patient unconscious on the floor. What is the nurse's first action? A. Call a code. B. Check for pulse and breathing. C. Notify the healthcare provider. D. Start chest compressions. Answer. B. Check for pulse and breathing. Question 3. Which patient should the nurse see first after receiving shift report? A. A patient with a temperature of 101.2 degrees Fahrenheit reporting chills. B. A patient with a new onset of confusion and slurred speech. C. A post-op patient requesting pain medication. D. A patient requesting assistance with toileting. Answer. B. A patient with a new onset of confusion and slurred speech. Question 4. What is the most important strategy to prevent central line-associated bloodstream infections, CLABSIs? A. Use sterile technique when accessing the line. B. Flush the line with saline once per shift. C. Place the line in the femoral vein. D. Change the dressing every 5 days regardless of condition. Answer. A. Use sterile technique when accessing the line. Question 5. Which medication order should the nurse question immediately? A. Warfarin 5 mg PO daily for a patient with 1.8 Indian rupees. B. Digoxin 0.125 mg PO daily for a patient with HR 58 BPM. C. Acetaminophen 650 mg PO for a headache. D. Insulin Lispro for units with meals. Answer. B. Digoxin 0.125 mg PO daily for a patient with HR 58 BPM. Question 6. Which patient is at greatest risk for developing a healthcare-associated infection, HAI? A. A 35-year-old with a history of asthma. B. A 28-year-old with a sprained ankle. C. A 72-year-old with an indwelling urinary catheter. D. A 45-year-old with stable hypertension. Answer. C. A 72-year-old with an indwelling urinary catheter. Question 7. What is the nurse's priority when caring for a patient with impaired mobility? A. Increase fluid intake. B. Perform range of motion exercises. C. Apply compression stockings. D. Turn and reposition every 2 hours. Answer. D. Turn and reposition every 2 hours. Question 8. A nurse is precepting a student who prepares to administer a medication without scanning the barcode. What is the preceptor's best action? A. Allow the student to proceed. B. Remind the student to scan the medication. C. Report the student to the supervisor. D. Administer the medication instead. Answer. B. Remind the student to scan the medication. Question 9. Which action best prevents medication errors during handoff communication? A. Relying on the EMR alone. B. Using SBR format to report information. C. Sharing only abnormal findings. D. Delegating report to the UAP. Answer. B. Using SBR format to report information. Question 10. Which task should not be delegated to a UAP? A. Assisting with feeding. B. Obtaining routine vital signs. C. Assisting with bathing. D. Performing post-mortem care alone. Answer. D. Performing post-mortem care alone. Question 11. What is the nurse's best action when a patient refuses a scheduled medication? A. Document the refusal and explain the consequences. B. Hide the medication in the patient's food. C. Reattempt administration without informing the patient. D. Notify the pharmacy. Answer: A. Document the refusal and explain the consequences. Question 12. The nurse is reviewing fall prevention strategies. Which action should be questioned? A. Keeping bed in lowest position. B. Leaving the call light within reach. C. Removing night light to reduce sleep disturbance. D. Encouraging use of non-skid footwear. Answer: C. Removing night light to reduce sleep disturbance. Question 13. Which patient would benefit most from hourly rounding? A. A patient with stable vital signs. B. A patient receiving 4 fluids. C. A patient with a history of frequent falls. D. A patient who is NPO before surgery. Answer: C. A patient with a history of frequent falls. Question 14. What is the first step in preventing surgical errors in the OR? A. Administer prophylactic antibiotics. B. Complete the timeout procedure. C. Verify the consent with the family. D. Mark the site after sedation. Answer: B. Complete the timeout procedure. Question 15. The nurse enters a patient's room and notices sparks from the 4 pump. What should the nurse do first? A. Unplug the equipment immediately. B. Use a fire extinguisher. C. Evacuate the patient. D. Call maintenance. Answer: C. Evacuate the patient. Question 16. A patient is receiving 4 heparin and starts bleeding from the gums. What is the nurse's priority action? A. Stop the infusion and notify the provider. B. Administer protamine sulfate. C. Check the APTT result. D. Apply pressure to the gums. Answer: A. Stop the infusion and notify the provider. Question 17. Which intervention reduces the risk of aspiration during enteral feeding? A. Infusing the formula rapidly. B. Keeping the head of bed flat. C. Verifying tube placement before feeding. D. Administering feeding while the patient sleeps. Answer: C. Verifying tube placement before feeding. Question 18. What should the nurse do when a patient with tuberculosis needs transport for imaging? A. Place the patient in a private vehicle. B. Notify security for assistance. C. Apply a surgical mask to the patient. D. Cancel the test to avoid exposure. Answer: C. Apply a surgical mask to the patient. Question 19. Which behavior best supports a culture of safety? A. Withholding concerns to avoid conflict. B. Reporting near misses without fear of punishment. C. Avoiding documentation of minor errors. D. Correcting coworkers in front of patients. Answer: B. Reporting near misses without fear of punishment. Question 20. What is the most effective way to prevent transmission of infections in healthcare settings? A. Wearing a gown for all patient contact. B. Using hand sanitizer before charting. C. Performing hand hygiene before and after patient contact. D. Wearing gloves when entering a patient's room. Answer: C. Performing hand hygiene before and after patient contact. Question 21. Which scenario requires the nurse to activate the rapid response team? A. A patient with blood pressure 110/70 mmHg. B. A patient with new onset chest pain and shortness of breath. C. A patient who requests to speak with a chaplain. D. A patient who is sleeping and difficult to arouse during the night. Answer: B. A patient with new onset chest pain and shortness of breath. Question 22. A nurse finds a medication error, but the patient was unharmed. What is the appropriate next step? A. Ignore it since no harm was done. B. Notify the patient's family. C. Complete an incident report. D. Wait until the next shift to report it. Answer: C. Complete an incident report. Question 23. A nurse notes that a surgical consent form is signed, but the patient appears confused. What is the best action? A. Proceed with pre-op preparations. B. Notify the charge nurse. C. Ask the family to confirm understanding. D. Inform the provider the patient lacks understanding. Answer: D. Inform the provider the patient lacks understanding. Question 24. The nurse hears an alarm from an infusion pump. What is the first action? A. Silence the alarm. B. Check the infusion site and tubing. C. Reset the machine. D. Call for assistance. Answer: B. Check the infusion site and tubing. Question 25. Which task should not be assigned to a float nurse unfamiliar with the unit? A. Assisting a patient with ambulation. B. Performing a central line dressing change. C. Monitoring intake and output. D. Answering call lights. Answer: B. Performing a central line dressing change. Question 26. What is the nurse's priority when caring for a patient with a new tracheostomy? A. Provide nutritional teaching. B. Assess for bleeding and respiratory distress. C. Educate on home care. D. Check bowel sounds. Answer: B. Assess for bleeding and respiratory distress. Question 27. What is the nurse's best response when a patient asks for a sleeping pill not prescribed? A. Tell the patient to wait until morning. B. Ask the provider for an order. C. Administer an over-the-counter medication. D. Tell the patient to try relaxation techniques. Answer: B. Ask the provider for an order. Question 28. What is the best action to take when a patient refuses to wear identification bands? A. Document and proceed with care. B. Place the band on the four-pole. C. Educate the patient about its importance. D. Discharge the patient. Answer: C. Educate the patient about its importance. Question 29. What should the nurse do when noticing that the wrong dose of medication has been prepared by the pharmacy? A. Administer it and monitor the patient. B. Call the provider for approval. C. Send the medication back and report the error. D. Adjust the dose manually. Answer: C. Send the medication back and report the error. Question 30. Which finding should be reported to the provider immediately? A. Blood glucose 108 milligrams per deciliter. B. Heart rate 60 BPM in a resting patient. C. Sudden confusion in a patient post-op. D. Urine output of 480 milliliters in 8 hours. Answer: C. Sudden confusion in a patient post-op. Question 31. Which action demonstrates correct use of restraints? A. Tying the restraint to the side rail. B. Releasing restraints every 4 hours. C. Using restraints as a first response to agitation. D. Obtaining a new order every 24 hours. Answer: D. Obtaining a new order every 24 hours. Question 32. What is the best method for identifying a patient prior to administering medication? A. Ask the roommate to confirm. B. Check the room number. C. Use 2 patient identifiers. D. Match the patient's face with the photo in the chart. Answer: C. Use 2 patient identifiers. Question 33. Which activity can a nurse delegate to a UAP? A. Monitoring a patient's for infusion. B. Teaching incentive spirometry use. C. Assisting a patient with morning hygiene. D. Assessing lung sounds. Answer: C. Assisting a patient with morning hygiene. Question 34. A patient is receiving chemotherapy. What is the nurse's highest priority? A. Managing fatigue. B. Preventing infection. C. Promoting nutrition. D. Educating about hair loss. Answer. B. Preventing infection. Question 35. What is the safest way to transfer a weak patient from bed to chair? A. Use 2 people and a draw sheet. B. Have the patient stand up quickly. C. Let the patient transfer independently. D. Use a gait belt and lock the wheelchair. Answer. D. Use a gait belt and lock the wheelchair. Question 36. The nurse receives a new prescription with unclear handwriting. What is the best action? A. Ask a coworker to interpret. B. Administer based on past orders. C. Call the provider for clarification. D. Hold the medication until the next shift. Answer. C. Call the provider for clarification. Question 37. What is the most appropriate action if a nurse notices a break in sterile technique during a procedure? A. Continue the procedure to avoid delay. B. Notify the patient afterward. C. Correct the break immediately and restart sterile setup. D. Wait until the procedure is completed. Answer. C. Correct the break immediately and restart sterile setup. Question 38. Which intervention is essential for preventing ventilator-associated pneumonia, VAP? A. Increasing sedation. B. Elevating the head of the bed. C. Providing for hydration. D. Suctioning once per day. Answer. B. Elevating the head of the bed. Question 39. A newly admitted patient reports an allergy to shellfish. Which assessment is most important? A. Ask about dietary restrictions. B. Determine reaction type to iodine or contrast dyes. C. Document it in the food preferences section. D. Order a low-sodium diet. Answer. B. Determine reaction type to iodine or contrast dyes. Question 40. What is the nurse's priority when transferring a patient from the emergency department to the medical unit? A. Give a verbal handoff using SBR format. B. Ask the family to explain the patient's history. C. Send the patient with a UAP. D. Ensure the patient has eaten before transfer. Answer. A. Give a verbal handoff using SBR format. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.